Well, let's turn our mind to gene therapy, the promise, the future, and, well, the very present day experience of people who are learning more about it, both scientifically and for their own families. Elizabeth Finkel is a former biochemist and a former editor of Cosmos magazine, that very prestigious science magazine, and she has been looking at gene therapy partly because of scientific curiosity and partly because she found somebody who knew more about it without a science background. Elizabeth Finkel, thank you for being here.
My pleasure.
The person who knew more about it is Megan Donnell. She's a mother of two, Sydney woman. She's got one daughter called Isla, who's aged 9, and a son called Jude, aged 7. And she's the person who knew more about gene therapy, and for a reason you'll find out in a moment. Megan, great to have you here. Thank you so much for being here. Your children have there's no other way to say it, they have a terminal genetic illness known as Sanfilippo Syndrome. You never wanted to be an expert in this syndrome, but you are one now. Can you describe it to us in the most simple terms? What is this disease?
In simple terms, it's a genetic disorder. My husband and I were both healthy carriers of Sanfilippo syndrome. We'd never seen it in our families because we both had a healthy copy of the gene, and so it didn't present in any way in us. And unfortunately, when we came to have children, we both passed the faulty copy of the gene, and we did it twice, which was really unlucky. There's no other way to describe that. The way that the condition presents in children is the early stage of development is as you would expect in any child. They're seemingly healthy at birth, and they hit all of their early milestones. Typically around the age of 3 or 4, we start to see some developmental delays in these children, and those developmental delays grow and progress into very significant issues. So behavioural issues, intellectual disability, and eventually they begin to lose all of their fundamental skills, their ability to walk, to talk and to swallow, and they eventually are facing a limited lifespan of somewhere in the mid-teens. So it's a progressive brain damage, if you like, and it's classified as a childhood dementia.
Wow, okay. And it has something to do with enzymes and chromosomes and materials in the body going back through the brain, which is what makes it
That's correct. Yeah.
Degenerative. So at 9 and 7, the disease is showing its hand in both your children. But how did you realise that they had it?
It was a typical case of mother's intuition, I think. My daughter started to show a very mild developmental delay around the age of 2, but it was so tiny. Every time I'd raise it with a medical professional, I was really dismissed that, she's on the regular curve of development, that, she will catch up, you being neurotic, was the message that I received. But I think something in my gut niggled at me that something wasn't quite right. So initially it was, she had a lot of single words but wasn't joining them up as I was seeing her peers do. And then when it came time to toilet train her, that took a really long time. And so I guess both of those things together made me worry that there was something else going on with her. And I used to take her to the paediatrician and the GP and anybody that would listen, and every sort of few months I'd be reassured that she was fine. And this went on for a few years until eventually we started at a local preschool, and the director of the preschool approached me and said, I've noticed a few developmental issues. Are you concerned? And I was like, absolutely. I was relieved, actually, that somebody else could see it. And so she pointed me in the direction of a unit that do assessments so that we could identify, where best to put our energies in terms of therapies and things that we were doing with her. And thankfully, that unit's protocol included to do a genetic screen, and it picked up Sanfilippo. I guess the really shocking thing for us was that I'd never considered that there was anything wrong with my son. He was developing beautifully, and I'd put all of my energy into Isla. And that moment, I suppose, when I realised this is genetic and the chance of him having it is also 1 in 4, was a dreadful moment.
And as it happened, luck was against you, and he does have it.
Yeah.
Yeah, and you didn't realise that Isla had it before he was even born. He was a newborn when you started to really pick up these signs.
Yeah.
Gee, that's such bad luck. It's just really quite unfair the way the cards have fallen for you and your family. But Elizabeth, you worked in, science, tinkering with genes, with fruit flies. Tell us how you came to meet Megan and how your lives have sort of crossed over now.
Right, so it was at the end of last August at a startup conference called Above All Human, held in Melbourne, and it's for ethical startups. And one of these startups was called Eugene, a genetic testing company run by Zoe Milgram. So she asked me to be on a panel with her and with Megan. So in the course of being on this panel, I met Megan. And, my jaw dropped when she started talking about Sanfilippo, and she completely pulled the curtain back for me on the fact that the gene therapy revolution had arrived, that she was considering this futuristic treatment for her children, and that this was on the basis of very encouraging results from another terrible genetic illness called spinal muscular atrophy. So a 2017 report in the New England Journal of Medicine showed that 15 of these children with spinal muscular atrophy had shown very positive results from gene therapy. And if I can digress a moment to tell you about spinal muscular atrophy, which is even more terrible than Sanfilippo, these children, again, born relatively normal, often not picked up at birth. But normally in the course of a baby's development, you see them developing greater and greater muscular control as their motor neurons, the cables that connect their brain to their muscles, start sprouting and connecting up. And what happens in this terrible disease is that the motor neurons sprout and wither. So the babies, instead of developing more control, grow more and more paralysed and die somewhere between 15 and 2 months of age, unable to walk, unable to eat.
Gosh.
So this extraordinary result in the New England Journal of Medicine showed that these babies treated in the first few months of life with gene therapy were alive at the age of 3. And not only were they alive, all of them were at least crawling. A lot of them were walking and dancing. So it was, as Ian Alexander put it when I interviewed him, he's Sydney-based Westmead, a real pioneer of gene therapy, paediatrician and a researcher. And he used these words, biblical results.
Yes.
And I thought, whoa, I think this is the first time in my decades of science journalism I've heard this kind of language. Cure? That's a 4-letter word we're not supposed to use. Biblical results? Whoa.
Yeah.
But it was Megan who revealed all this to me. And I realised, oh my God, this is a story I have to follow up.
And you have done that, and you've written a piece about it for the monthly magazine. So back to you, Megan, you had found out basically what happened was once you had this diagnosis and realisation of the challenge that Isla and Jude faced, you hit the internet, started doing research. Actually, you were prompted by a friend to do this. Tell us that story because it's very moving.
Yeah, absolutely. Upon diagnosis, I think the really key message that we received from the diagnosing doctors and the specialists that we followed up with afterwards was don't have false hope, that this is not a disorder that we're going to find an intervention for your children. This is the progress. This is the prognosis of this condition. And in fact, one doctor said to me, don't go chasing the world looking for a cure. And I guess, it's really hard. You've been given this dreadful diagnosis. You're told not to question it. It is possibly the worst thing that you can imagine as a parent. So I guess I went into a little bit of a fog, for a few weeks and was trying to process and understand, that this was what was going to happen to my kids. And I have a very dear friend, Angeline Wienemann, who we'd worked together previously, and she's naturally very curious and highly intelligent. And so when I told her about the diagnosis of the children, her natural response was to get online and to research. And, thank goodness that she did, because I wasn't in a place where I was ready to even start to think about potentially challenging the diagnosis that we'd been given. And she eventually, about probably 4 or 5 weeks after the diagnosis, she staged a little bit of an intervention, I call it, where she basically outlined to me, these are all the research projects that are happening internationally. These are the clinical programs that are coming through the pipeline, and you need to get on board with this. And she described to me for the first time gene therapy. And to me at that point, it just sounded like science fiction, that you were going to use a virus to deliver the gene that's faulty in my kids into the cells of their brain. Are you kidding me? Like, that didn't, make any sense whatsoever. So she'd done all of this research and had outlined the various programs that were happening, and it meant that we were able to engage with the scientific advisors that we ended up working with on the foundation that we established, and got them looking at the various programs to see if there was anything that was coming that could potentially help either my kids, or by that stage, when we did start the foundation, which was 3 months after the kids were diagnosed, we'd met other families and we recognised that there was a really key opportunity here for Australian kids. And so she got the ball rolling, and I'm forever grateful for that. Yeah.
So within sort of 2 weeks of this, you'd quit your job and you'd devoted your life to finding out if there was possible there was a gene therapy. Well, I don't want to say cure, but I guess I'm starting to have to learn to say cure, but something that could be done. And you started the foundation, which is the Sanfilippo Children's Foundation. Wow. So you've taken action with the help of Angelique, who sounds like her name would suggest, a bit of an angel there. We're talking here with Megan Donnell. She's a mother of 2. Isla and Jude are the names of her children, who both have a terminal genetic illness known as Sanfilippo Syndrome, and also with Elizabeth Finkel, who is a scientist and also a journalist and has been looking at gene therapy. So I think that Megan's just given us a very clear and simple explanation of the delivery of this gene therapy. So you kind of use the mechanism of a virus to change the genetic structure of a human. Is that simple? Too simple?
No, and it is, like science fiction, like Megan said, and it's sort of a fantastic turning the tables on viruses, which have evolved to insinuate themselves into our cells and put themselves next to our DNA and co-opt the same machinery as we use to activate our own genes. But we've turned the tables on them, and we're now using them to deliver the genes that we want. And this began in the 80s with the genetic engineering techniques. People learned how to hack the genetic code. And the whole concept of gene therapy was really obvious from the 1960s, when Marshall Nierenberg first cracked the genetic code, the universal genetic code. What is true for viruses is true for human DNA. It's just a string of 4 letters, A, G, T, C, arranged in different sequence. It's a universal genetic code. And what that means is this would offer us ways now to hack into our own DNA code and change it. And with these severe genetic illnesses, they're terribly severe and often terribly simple. So in the case of Sanfilippo, these kids are just missing one gene for breaking down this sugar heparin sulfate. So if you could put into the virus payload, if you think of viruses like little spaceships, and you can put a little piece of DNA into their payload that you want them to carry into cells, then you could potentially cure that disease. And people could see that already in the 60s. By the 80s, genetic engineers had sort of started working with genetically engineering viruses, and the first trial of gene therapy was in 1990. It had some setbacks because the viruses that they used caused their own problems, huge inflammatory responses. We had Jesse Gelsinger dying as a result of gene therapy, and then we had some other kids developing leukemias because the gene therapy inadvertently activated cancer-causing genes. But over the decades, the genetic engineers have been tweaking, re-engineering the viruses to be safer. So we get to the current rebirth of gene therapy, where now we're, in the case of Megan, or in the case of spinal muscular atrophy, this disease that gave her so much hope, is that the viral engineers have found a virus that will cross the blood-brain barrier, which is what you need if you're going to treat a brain disease, and will carry in the gene that you need to fix that disease.
So a long time coming, this kind of technology, and I suppose we call it a technology, even though it's dealing with biological processes. So since the 60s, a lot of hope and lots of research, maybe some setbacks with these unfortunate trials that didn't go so well. But now we get to the point where you as a scientist and a science journalist are actually kind of taken aback by what Megan
I needed Megan to tell me what was going on. And so that was very, okay, how did I miss this? I was the editor of Cosmos magazine. Every Monday morning you'd find us, having our news meeting, scrolling through the press releases for that week, for the hot stories. We often did stories on CRISPR, and I think that was the problem. CRISPR dazzled us.
Tell us about CRISPR.
Right, so CRISPR is this new technique that allows you to edit the DNA of everything from mosquitoes to man. So it is a game changer. It makes genetic engineering cheap and fast and precise, and that's why it's captured the world's imagination. But the technique has not yet delivered anything in clinical trials.
Is this the technology that was used in China recently that caused
correct.
a lot of consternation?
Yes, that's right. Yes.
And what was that? There was a scientist used this technique on some twins, and one of the parents may have been HIV positive, and they were trying to see if they could take that out of the DNA of the twins. Is that what happened?
Yes. So the idea was the most controversial area of all, because we can apply gene therapy two ways. The non-controversial way, or relatively non-controversial way, is to apply it to a fully formed human being who's already there to try to correct a disease. And the ethicists of the world have agreed universally, that is an ethically defensible and laudable way to use genetic engineering.
Because despite the risks, the overwhelming good outweighs them.
That's right. However, when you're talking about eggs, or a fertilized embryo, which is what this scientist was addressing, He Jiankui, he was changing every single cell in that embryo, including the future eggs of those little girls, which means whatever he changed in those little girls will carry through in the germline.
A permanent change.
A permanent change for the
into
whole...
Into the human race.
Into the human race, yes. That's the big concern of so-called germline genetic engineering, because it will carry through the generations. But the more proximate ethical concern here was that while he defended what he did by saying, I'm going to tweak the DNA of these little girls so that they will be resistant to HIV, so he was tweaking a sort of gateway gene called CCR5 that allows the HIV virus to get into your cells. And people who don't have this gateway through a natural mutation are resistant to HIV infection. So this was his justification. Well, there was no real justification because there was no risk of them getting infected. But I guess because their parents came from an HIV community, maybe it was easier to get consent from them.
So those two little girls are alive, and they now
guinea pigs, basically.
They have this change in their genetic material. That doctor or the scientist, he's actually kind of disappeared. He's been discredited by his government, not realising perhaps he was ambitious, but not realising the full implications, or maybe he did and he just didn't care. But anyway, it's a fascinating story. But let's get back to your family, Megan. You've tracked down a group who are doing research in this, and there are trials for Sanfilippo kids, and you took part in it, or at least tried to. Tell us about that.
From a foundation perspective, the process was that we engaged a scientific advisory group because I obviously am not from a scientific background, so I rely very heavily on the expertise of specialists who looked at the various programs happening internationally and identified one that was showing particular promise. It had been developed in the US at a hospital, Nationwide Children's Hospital in Ohio, and the hospital had just spun off a biotech to take this particular product through the clinical trial pipeline. And that biotech was looking for seed funding. So it was a really opportune time for us to come along because they were looking for money and we were really desperate to find a way for Australian kids to access this international clinical activity that was going on. So we started to have a conversation with them around potential investment in them as a biotech, with the outcome of them agreeing to set up a clinical trial in Australia. So that was a really fortunate...
Mutually beneficial.
Yes. Exactly. And so we did invest in this particular organisation, and our objective was always absolutely on mission to get a clinical trial in Australia and to get Australian kids access to that. And I'm really pleased to say that did occur, that the first child was treated in July 2017 here in Australia. So that was a really wonderful outcome. A secondary outcome to that was we actually took a financial investment, as we would if we were a commercial investor as a foundation, and that turned into a windfall for us as an organisation. The biotech were taken over by an established listed pharmaceutical company, and our initial holding converted to a NASDAQ listing. And
oh, my goodness.
Yeah, so that was another
Wow.
piece of luck. So I've been very unlucky, but we've also had a lot of significant luck.
Gee.
So we've sold a good chunk of our investment, and we've been able to reinvest those funds into programs for our community, which is just the most amazing outcome that we could imagine.
And there is very big money in this, and I'm going to ask you about that in a moment, Elizabeth. But your kids, did they get a chance to be part of this trial?
Yeah, so I guess when we started, my expectation was that this would be for the next generation of children, and that it was more, my motivation was more as building a legacy, I guess, for Isla and Jude. As it happened, the timing was such that they could be considered, and I'm obviously not allowed to talk about, any participation or non-participation, but I can say, quite tragically, my son screened for the clinical trial. He did very well. He ticked all of the boxes and was looking to be quite a good candidate to participate. And we got to the very final hurdle, and that was to test to see, it uses a virus, to see if he'd come in contact with a virus that was similar to that, which may result in an immune response in him if he saw that virus. And unfortunately, at some point in his life, he had been exposed to the virus or a similar virus, which meant he had antibodies, and we knew that those antibodies would neutralise the treatment. And so, to get so close and to miss out was absolutely devastating. It was like receiving the diagnosis all over again.
Yes, and you've gone so far along all those pathways to get there.
But it's a challenge that faces the field, and I think, at that stage, it was sort of 2 years ago, and we know a lot more now. At that stage, we were thinking there was a 5% risk of antibodies. What we're seeing in the field is more like 30%. And so this is a challenge for the field to address, not just for Sanfilippo, but for any of the genetic therapies that are coming through.
So I know you can't talk about the trial at all because it's got confidentiality agreements that you've signed, but is there any good news for you out of this trial?
There's great news for us as a community out of the trial to see really promising results, and it is still early days, and it's going to be quite a number of years before we really know whether this has been an effective treatment or not. But certainly the data that the company have released is looking very promising, and so for us as a community, that's a tremendous outcome. Yeah.
Elizabeth Finkel, there's so much money in the pharmaceutical world. Like, they're just mind-boggling figures. And to know that Megan's been able to jag just a little part of that is sort of fantastic. But you've pointed out that last May, Novartis spent $8.7 billion US to purchase a gene therapy company that's working on this spinal muscular atrophy that you're talking about. And this February, Roche spent $4.8 billion to buy another gene therapy product that's related to treating blindness. These are enormous numbers for rare diseases. What's the business model? How are they going to make this money back?
That's a great question. The global population size for Sanfilippo would be, about 2,000, if that.
In the world, so it's sort of 1 in 70,000 children, I think.
Yeah, it's difficult to know how many in the world. It's something we've tried to calculate a few times. It's 1 in 70,000 live births, depending on how long they live. So it's difficult. No one's done a study on actual prevalence. So we know incidence, but we don't know the actual prevalence. So we think about 2,000 babies a year born, but nobody's done the study.
And maybe many never get a diagnosis.
But less than 100 in Australia.
Yeah, right. So the maths don't kind of stack up.
Or spinal muscular atrophy in the US, 400 babies maybe a year. So why is Novartis paying $8.7 billion to buy this startup company, Avexis? It was a big question. I really struggled to try to answer that. I think there's a few reasons. I think these big companies are seeing the future of medicine and that gene therapy is going to be the new platform. At the moment, you find ways to deliver drugs. You have to, by various means, you're limited. you're limited by the way you can deliver the drug and the nature of the drug. But this is going to introduce a whole new way of delivering drugs, a whole new platform.
But it does make it for an awful arithmetic if it's going to cost, $1 million for a treatment or a therapy that you know is going to make all the difference, then who wouldn't go the whole way? And what if it's not just $1 million? What if it's $5 million? And do we then expect governments to pay for these treatments and the endless sort of cash cow for the pharmaceutical companies? Or do we hope that eventually that becomes cheaper and it's available to everybody on a more democratic basis?
So there is a strong health and economics argument for gene therapy, even with a $3 million price tag, which is what just on May 24th, Novartis announced that this gene therapy for spinal muscular atrophy had been approved by the FDA, and they were pricing it at US 2.1 million, which is Australian $3 million.
So they've factored in all the care and treatment that a life without treatment would cost. Maybe that's what they've cared. Well, this presents a moral question beyond the questions that have already been raised by the technology themselves. But you're kind of very excited about this, Elizabeth, and obviously, Megan, you've devoted your life to this. This is a good news story.
I think it's a good news story. It's a game changer story. It's a challenging story. But, Australia's been world leading as far as bargaining down the cost of exorbitantly priced drugs as it did for Hep C, and managed to treat every patient with Hep C. Hep C drugs, Solvadi, when it came on the market, was $100,000. And we've treated and are on the way to treating all of our patients, 230,000 of them, for $9,000, which the government has paid by bargaining down the drug companies. So health economists that I speak to don't see this as ludicrous. They say their health models are equipped to deal with these sort of jaw-dropping price tags. So let's see.
Well, the figures aside, I guess the human story is that hope is the most important thing. And I guess that's been so much part of your life as you've had to cope, Megan, with the the news and the grief.
Absolutely. Yeah, absolutely. It's been quite incredible to go from a point where we were told by the doctors there is absolutely nothing that's going to come in your child's lifetime to, 5 or 6 years later, the children who are diagnosed are receiving a very different message. There's a clinical trial. Are you interested in participating? And I think the diagnosis and the news of their child's condition is probably no less devastating as it was for us, but the outcome and what they do in terms of the next steps is entirely different.
Well, thank you for your work in this area, for making a difference. And Elizabeth Finkel, thank you for talking to us and uncovering this extraordinary story as well.
My pleasure.
Yeah, wonderful to speak to you both. Megan Donnell is the mother of Isla and Jude, 9 and 7, and she's also the founder of the Sanfilippo Children's Foundation, which is making extraordinary big steps in gene therapy in lots of different ways for kids here in Australia. Elizabeth Finkel is a former biochemist, a former editor of Cosmos magazine, and she's written this extraordinary piece in the Monthly, and you can track it down. And once again, thanks both of you for talking and explaining this to us so well. It's been great to meet you both.